Hello, everyone, and welcome to week two. Today, we will discuss nursing today. Nursing is both an art and a science. The science of nursing is built upon a body of knowledge that continues to grow through research, evidence based practice, and professional experience. The art of nursing is reflected through compassion, caring, respect, and concern for human dignity. As healthcare systems evolve and society changes, nursing continues to evolve as well. Modern nurses care not only for individuals but also for families, communities, and populations. In this session, we will explore the foundations of contemporary nursing and examine the professional roles and responsibilities of nurses in modern healthcare. So, by the end of this session, you should be able to define nursing, explain the nursing metaparadigm, describe nursing as a profession, identify professional roles and responsibilities of nurses, and discuss characteristics of contemporary nursing practice. Before discussing nursing as a profession, we first need to answer a fundamental question: what is nursing? In Indonesia, nursing is defined as a form of professional care and service that is an integral part of healthcare. It is grounded in both the science and the art of nursing and is directed toward individuals, families, groups, and communities throughout the human lifespan. Several important ideas are reflected in this definition. First, nursing is a profession, not simply a collection of tasks or technical skills. It is a discipline with its own body of knowledge, standards of practice, and professional responsibilities. Second, nursing is grounded in both science and art. Nurses apply scientific knowledge, critical thinking, and evidence based practice while also demonstrating compassion, empathy, and respect for human dignity. Third, nursing serves people across the entire continuum of health and illness. Nurses provide care not only to people who are ill, but also to individuals, families, groups, and communities who are healthy and seeking to maintain or improve their well being. This understanding is consistent with international perspectives from the International Council of Nurses, or ICN, and the American Nurses Association, or ANA. Although the wording may differ, these organizations share a common view that nursing promotes health, prevents illness, supports recovery, advocates for patients, and helps improve quality of life. In simple terms, nursing is a profession dedicated to caring for people and helping them achieve and maintain optimal health throughout life. Imagine you need to choose a nurse. The first nurse is highly knowledgeable but communicates poorly and shows little compassion. The second nurse is caring, empathetic, but lacks strong clinical knowledge. Which nurse would you choose? Most people would say they want both. And yes, because the best nurse combines both. This is exactly why Potter describes nursing as both an art and a science. Effective nursing requires scientific competence together with caring relationships. You were introduced to these concepts during week one. Today, we briefly review them. These four concepts are known as the nursing metaparadigm and form the foundation of nursing knowledge and practice. Although healthcare continues to evolve, nurses still focus on people, their health, the environments affecting health, and nursing interventions that promote well being. Before discussing nursing as a profession, it is helpful to understand how nursing has developed over time. Although caring for people has existed throughout human history, nursing was not always recognized as a profession. In its earliest forms, care was often provided by family members, communities, and religious groups. This period is represented here as early caregiving. A major turning point occurred during the Nightingale era. Florence Nightingale helped transform nursing by emphasizing observation, sanitation, documentation, and the use of evidence to improve patient outcomes. Her work laid the foundation for modern nursing practice. As nursing developed further, formal education programs, professional organizations, standards of practice, and codes of ethics emerged. Nursing became recognized as a profession with its own body of knowledge and scope of practice. Today, we practice contemporary nursing, which is evidence based, patient centered, collaborative, and is increasingly supported by technology. Nurses work not only in hospitals but also in communities, schools, public health settings, research institutions, and many other areas. When comparing earlier nursing with contemporary nursing, we can see several important changes. Nursing has moved from informal caregiving to professional practice, from experience based decisions to evidence based care, and from a primary focus on disease to a more holistic focus on the person, family, and community. Although nursing has evolved significantly over time, one thing has remained constant: the commitment to caring for people and promoting health. Florence Nightingale is considered the founder of modern nursing. During the Crimean War, she observed that many deaths were related to poor sanitation rather than battle injuries themselves. She used data and statistical analysis to demonstrate the relationship between environmental conditions and health outcomes. Her emphasis on hygiene, observation, and evidence continues to influence nursing practice today. Before we discuss what nurses do, it is important to understand why nursing is considered a profession. A profession is more than a job or a collection of tasks. According to Potter, several characteristics distinguish a profession from other occupations. First, nursing requires specialized education. Nurses complete formal academic and clinical preparation before entering practice. Second, nursing is supported by a body of knowledge that comes from nursing theory, research, science, and evidence based practice. Third, nursing provides a valuable service to society by promoting health, preventing illness, and caring for people across the lifespan. Fourth, nursing involves autonomy. Professional nurses make independent clinical judgments and are accountable for their decisions and actions. Finally, nursing practice is guided by a code of ethics, which provides standards for professional conduct and helps nurses make ethical decisions in practice. Because nursing demonstrates these characteristics, it is recognized as a profession rather than simply an occupation. If nursing is a profession, then what exactly do professional nurses do? Let's look at the different roles nurses perform in contemporary healthcare. Nurses perform several professional roles simultaneously. As caregivers, they provide direct care. As educators, they teach patients and families. As advocates, they protect patients' rights. As communicators, they coordinate care. As managers and leaders, they contribute to safe and effective healthcare delivery. Professional nursing requires all these roles working together. The responsibilities of nurses have expanded over time. Historically, nurses focused largely on comfort and care. But today, nurses are also responsible for health promotion, illness prevention, quality improvement, and patient safety. Professional nurses must maintain competence throughout their careers and remain accountable for their practice. And professional responsibility continues throughout a nurse's career. Contemporary nursing is shaped by changes in healthcare, technology, and society. Modern nurses are expected to use evidence to guide practice, place patients at the center of care, collaborate with healthcare teams, and continue learning throughout their careers. Because healthcare serves increasingly diverse populations, cultural competence is also essential. Nurses must provide respectful and culturally responsive care. Technology and informatics have become important tools for improving communication, documentation, patient safety, and decision making. These characteristics distinguish nursing practice in the 21st century. The nursing profession continues to evolve. Healthcare systems are becoming increasingly complex, and nurses are expected to play a greater role in leadership, decision making, quality improvement, and policy development. As future nurses, you will need not only clinical knowledge but also critical thinking, adaptability, teamwork, and professionalism. Some nurses may pursue advanced education, including master's, PhD, or DNP programs, as part of lifelong professional development and to contribute to practice improvement, leadership, and research. Although nursing has evolved significantly over time, its fundamental purpose remains unchanged: caring for people and promoting health. As you continue your journey in nursing, I encourage you to think about the kind of nurse you hope to become and the impact you hope to make on the lives of others.